Hello, this is Margie Meady recording the PowerPoint for Psychopharmacology for this course. I just wanted to let you know that I copied over the lectures from the pharmacology class that talked about these particular drugs. So there's a whole separate folder in this week's content, and in that folder you will find the name of the folder is Review Material Psych Mental Health Pharmacotherapy for this from the pharmacology course, and in there I've copied over the PowerPoint and the lecture for the drugs for anxiety and insomnia, the drugs for emotional and mood disorders, and the drugs for psychoses. I'll go ahead and cover some details that are specific to this course in the next few slides. So to give you some historical perspectives, before 1950, sedatives and amphetamines were the only significant psychotropic drugs that we had available. So they weren't the wide range of drugs. There wasn't the wide range of drugs to treat these disorders that we have nowadays. And what's happened is we've tried to not only improve the mechanisms of action that would alleviate the symptoms of mental health disorders, but we also were trying to minimize side effects that could occur. So since the 1950s, we have drugs that have expanded to include antipsychotic drugs, antidepressant drugs, and anti-anxiety drugs. Psychotropic drugs are intended to be used as an adjunct, which means they're used to facilitate other treatment interventions that could be used for mental health or psychiatric illness. So in addition to using drugs, we use individual or group psychotherapy and other kinds of interventions to treat mental health disorders. It's important to understand the role of the nurse whenever you're giving psychotropic medications, so we have to understand the ethical and legal implications. There's a lot of those implications associated with the administration of psychotropic medications. In other words, when are they appropriate to be given? When should they be held? How much right does a patient have to refuse to accept medications? So there's a lot of differences in states, and most states believe that it's the client's right to refuse treatment, which would include medications, except in emergency situations. So a lot of times when we were evaluating whether to give medications in a critical situation where a client was out of control with their emotions and responses and they were combative and aggressive, it got to the point where we were hesitant to give medications in those situations because they thought of that as a chemical type of restraint, and there was a lot of ethical considerations regarding restraining patients in any situation, including chemically, as well as with restraints, and that's going to be covered in the other PowerPoint about other legal and ethical situations. But the giving of drugs was considered a chemical restraint, and so we were hesitant to do that. But this is talking about except in emergency situations. They've come around to believe that medications often are very needed to relieve or alleviate the extreme situations, the emotions that a patient's feeling. So if you think about it, pain can be a physical source or pain can be an emotional source. And in an emergency situation, when a patient is out of control, combative, aggressive, having the potential to injure themselves or others, they are in a situation where they're experiencing emotional pain, and to withhold medications that could alleviate that pain is now being looked at as a justifiable situation, and there is a reason to go ahead and give those medications. We always have to do a thorough baseline assessment before we give a client any kind of a regime of psychopharmacologic therapy, because there's a lot of underlying conditions that could be contraindications to giving these medications, and there's a lot of, I want to highlight this point, there's a lot of physical conditions that can be manifested as psychological symptoms. So if we don't determine that a patient actually has an underlying physiologic condition that is causing these psychological symptoms, then we are going to be doing a lot of harm by trying to address symptoms that should be dealt with in a different way. For example, if they're in a delirium state because a medication has caused them to be that way, and then we give them other medications to treat that confusion, then we've missed the boat. We haven't done a thorough assessment. So an example that I can give you is a lot of times elderly patients have what we call a paradoxical reaction to medications that are supposed to relieve their anxiety. So they're anxious and agitated and confused on the medical unit, and we're giving them a medication to calm their anxiety. A lot of times it's simply because they're in a strange situation, a strange environment in the hospital setting, and they're confused and agitated, and then you give them an anti-anxiety medication and they get worse. Instead of it relieving their symptoms, it causes the opposite effect. It actually makes them more agitated. If we don't understand that that's what's going on, then we're doing them more harm than good. So always do those baseline assessments, understand if there's a physiologic basis for their symptoms, and address those physiologic conditions before you start giving medications to confuse the issue. Whenever medication administration is an appropriate thing to be using for this patient, the nurse is the key healthcare professional that's in contact with that individual that's getting that medication. You're the one that's going to be assessing for, number one, is this medication indicated? Number two, is it having the intended effect? Number three, is it having any side effects or adverse reactions? And number four, are we evaluating whether or not this medication is effective in having an ability to address this patient's condition? Or do we need to adjust it? Do we need to think of a different medication? And we are also very vital in the role of providing client education, and that just is not to the client, but also to the family or other caregivers that might be involved in this client's care. So there's a lot of information to relate about medication treatment, and we have to provide that education in terms that can be understood by the client and the family, or they're not going to be able to be adherent to their medication regime. This is just an overview from anatomy and physiology and the basic pharmacology class that we already had in this program, but neurotransmitters are those chemicals that are stored in the axon terminals of the presynaptic neuron, and an electrical impulse through the neuron stimulates its release into the synaptic cleft, and that determines whether or not we're going to have an electrical impulse generated. So just make sure you understand what a neurotransmitter is, because a lot of these medications impact the neurotransmitters. Remember when we talked about these in pharmacology class, we said that these drugs are not creating new neurotransmitters. They're not telling the neurotransmitters to do something they don't normally already do. We just are impacting whether or not they are enhancing, whether these drugs are going to enhance how these neurotransmitters act, or maybe they're going to block how these neurotransmitters act. So you kind of have to understand these terms. And if you don't remember them, again, go back into the PowerPoint lectures recordings that I've already put in there. I did not copy over the autonomic nervous system drugs and how drugs impact the autonomic nervous system. If any of you feel that you need that, you can go back to your pharmacology class and watch those recordings as well, or if you let me know, I'll go ahead and transfer them over to this course as well. But receptors are those molecules that are on the cell membranes that are what the neurotransmitters bind to. So they're the sites that those neurotransmitters are going to interact with. Reuptake is when we inactivate the neurotransmitter by having it be reabsorbed into the presynaptic neuron from which it has been released. So a lot of drugs will impact the reuptake of neurotransmitters. And this slide is just a nice overview of the mechanisms of actions of psychotropic medications. The antidepressants are going to block the reuptake of biogenic amines. Antipsychotics are going to block dopamine and other receptors. The benzodiazepines are going to facilitate the transmission of GABA. And the psychostimulants are going to increase the release of biogenic amines. So what I did is I gave you the way that you could kind of create drug cards or a list of the important information that you need to know about different medications. So you get the background assessment data, which is whether or not this drug is actually indicated for this person. Is this patient does this patient have a condition that means that this drug would be effective for them? Are they having an anxiety disorder or a symptom of anxiety? Are they in acute alcohol withdrawal? So again, we're talking about anti-anxiety agents. These are the indications for giving these types of drugs. How they work is they depress the central nervous system, except in the case of buspirone. And then I've listed that you should be aware of the contraindications or precautions for a particular drug class, and then you should be aware of the interactions. All of this is listed in your book in this particular chapter, and this PowerPoint would have gone on and on and on if I did this for every single drug class. But to move forward, the other thing that you want to know by following the nursing process for these different drug classes is then what are the issues regarding giving medications from this class to a patient. If you give these medications that are anti-anxiety agent, the patient's going to be at risk for injury. They have a risk for anxiety. Remember that balancing act that we talked about in the pharmacology class? Yes, they are getting this medication for anxiety, but we don't know if it's going to be effective enough, if the dose needs to be adjusted. And then I already talked about the fact that somebody could have a paradoxical reaction. They could have a risk for activity intolerance, or risk for acute confusion, disturbed sleep pattern, and they oftentimes don't know enough about the medication, so we have to provide that patient education. Then you're also going to be monitoring for the specific side effects of any drug class that you're giving, and I listed what would be specific for the anti-anxiety agents here. They're going to be probably drowsy, maybe confused, lethargic. They could be developing a tolerance to the medication, and you all remember what that meant from pharmacology class, where they need higher doses in order to get the intended effect. They could become physically or psychologically dependent on the drug. They could enhance the action or potentiate the action of other central nervous system depressants. They could aggravate depression. They can cause orthostatic hypotension. I talked about the paradoxical effect. Then these other symptoms that could be witnessed that we have to advise the patients to watch out for, and then we watch out for them too. So, and then a big part of our implementation is educating the client and the family about the drug. And then our outcome criteria and evaluation is to determine whether they are having the intended effect, and whether it's addressing the situation as well as possible, or whether we need to suggest that dosages get adjusted by the physician, or whether we think that they're having symptoms that maybe those drugs are not the appropriate drugs for these patients. So all of these things, these two slides were following the nursing process and what you have to think about for all of the different drugs that are in the book. And I didn't go on and on for all of the different drug classes. You will cover, when we get into specific mental health psychiatric diagnosis, we'll talk about the different drugs that are used for those different conditions. And in your lab section of this class, your lab instructors will talk about different medications that are used, and you'll be discussing medications in your lab class as you go over case studies of patients that are being treated for these conditions, and then part of that treatment includes medication. So medication cards or medication lists, and writing out how these drugs work and what they're going to do to treat the specific symptoms of these conditions is a big part of your lab course. And so again, I've put the recordings from pharmacology class if you want to review those, and you can create your own sample nursing process cards for any of the drug classes that are in your book. So I've given you a couple of example quiz questions to help you understand what kinds of medication questions could be on either an exam or a quiz. So which of the following medications would be an appropriate PRN medication? In other words, a medication that's given as needed for an individual with anxiety symptoms. And in this case, alprazolam would be the correct answer, because that's a benzodiazepine and it works as a central nervous system depressant to produce a quick acting effect of relaxation on an individual with anxiety symptoms. Buspirone has a delayed effect, so it wouldn't be used on a PRN basis. Fluoxetine and sertraline may be used on a long-term basis with individuals who have anxiety disorders, but are not effective on a PRN basis for anxiety symptoms. If you recall back from pharmacology class, we talked about drugs that are used for depression can also be used for anxiety disorders. So again, if you need to review that, go ahead and watch those recorded lectures on those specific topics. Okay, a client who takes haloperidol begins to show tremors and a shuffling gait. Which of the following PRN medications should the nurse choose to administer for these symptoms? The correct answer in this case is C, benztropine. The client is exhibiting symptoms associated with drug-induced extrapyramidal symptoms, or otherwise known as EPS. We talked about EPS a lot in those recorded lectures from pharmacology class. So again, if you need a review of that, that is all covered in those lectures that are uploaded into the Blackboard content, and you can review them as many times as you need to get a recall. Go back into your pharmacology book and review all of those discussions that we've had about those and the content in the book about EPS. Chlorpromazine is an antipsychotic agent, diazepam is an anti-anxiety agent, and amoxapine is a tricyclic antidepressant. So you're trying to give the medication that's going to address the extrapyramidal symptoms, and that would be C. A child is taking guaifenesin for ADHD. Which of the following would be part of the client education associated with administration of this medication? I'll give you a second to look over these choices. The correct answer is D. Do not discontinue the medication abruptly. Clients that are taking an alpha agonist, remember the term agonist means it stimulates that receptor. Remember, an antagonist would block the receptor. So this is an alpha agonist and it should not be discontinued abruptly. If they do discontinue these medications abruptly, they could result in symptoms of nervousness, agitation, headache, and tremor, and a rapid rise in blood pressure. Dosages should be tapered gradually under the supervision of a physician. Answer A is pertaining to MAOIs. Remember, we talked about the MAOIs are drugs that should not be taken with foods that contain tyramine. That's, again, all in those lectures that we had from pharmacology class. Answer B is more specific to tricyclic antidepressants, and answer C pertains to lithium. So these last three slides I took from the conclusion slides of the PowerPoint recordings that I did for pharmacology, because they were a really nice summation of the nursing considerations that we have to think about in general for these different drug classes that are utilized for these conditions that treat mental health or psychiatric disorders. And it kind of is a nice overview of what you have to think about when patients are on these medications. So for drugs that treat anxiety and insomnia, remember that when we talked about those in pharmacology class, we said sometimes it's hard to know which comes first, the anxiety that makes somebody can't sleep, or the fact that somebody can't sleep and then they get so anxious because they can't sleep that then they feel anxiety. So those two conditions go hand in hand. Anxiety and insomnia go hand in hand, and the drugs that treat anxiety can also treat insomnia and vice versa. And the drugs that can treat both of those conditions are the antidepressants, the barbiturates, the benzodiazepines, the non-benzodiazepine, non-barbiturate CNS depressants. So these medications are used for a variety of conditions. And as nurses, we have to be aware of the side effects and the safety concerns because they are central nervous system depressants. And patient education is required to minimize clients' dependence on these medications. Non-pharmacologic techniques should be attempted initially or as an adjunct to drug therapy. In other words, is there a way for us to help them address the anxiety before we need to give them medications? Is there a way to help them learn about sleep hygiene before we give them a medication for insomnia? Is there a way to help them deal with these conditions in ways that are not drug related? If that isn't going to work, or if we need to include drug therapy in addition to the non-pharmacologic techniques, then we realize that they go hand in hand. When patients are taking drugs for emotional or mood disorders, the kinds of drug classes that they'll be using would be the antidepressants, drugs for bipolar disorder, and drugs for attention deficit hyperactivity disorder. Patients that are taking these medications need a lot of emotional support in addition to the pharmacotherapy management. And it often takes several weeks for them to realize a therapeutic response, which can be very frustrating, as I've mentioned in our previous pharmacology class. It's very hard to have to expect that your symptoms are not going to be relieved for several weeks. I mean, if you're depressed and feeling that sad and hopeless, and somebody tells you, okay, we're going to help you with giving you some medication, but it's going to take several weeks for it to work, that's depressing idea in and of itself. The other idea is that it might not be the drug that is going to work for them as an individual, and we might have even more time before we evaluate whether or not this drug is having the intended effect for that person or not. Remember, highlight this in your notes. Suicidal ideation is a major concern and needs to be evaluated initially and ongoing when patients are on medications such as these. Family involvement is essential in order for these drugs to be effective. Strict adherence is crucial but very problematic, specifically due to the side effects and simply because of the fact that they're depressed or having emotional problems and they aren't thinking clearly, and it's hard for them to follow directions and medication instructions. And again, the non-pharmacologic interventions are very important in helping us achieve a successful patient outcome. When patients are taking pharmacotherapy for psychoses, they're going to be taking the conventional and atypical antipsychotics. These drugs need to be taken lifelong. So lifelong compliance is essential in order to control these symptoms and to give that client's life structure. If they do not adhere to the medication regime, remember their symptoms are going to return. And they don't often want to take these medications because they have very serious, very unpleasant side effects that are hard to manage. So family support, again, is very essential and necessary in order for us to get successful outcomes. The medication regimes might be disruptive because they might require blood work due to some of the side effects that occur, and so that's an unpleasant thing to have to incorporate into your life. But medication on the good side, on the positive side, can have a very positive impact on their quality of life. So you'll be discussing all of this when you talk about psychoses in your lab, and when we talk about this in those conditions later on in the semester when we get into those types of psychoses. We'll talk about these medications again and how effective they are at improving patients' quality of life. So I hope you found this PowerPoint beneficial, and I thank you for your attention.